Okay, on my hemifacial site, there are different questions about different things. And the vagus nerve, can the spine help problems with the vagus nerve? I'm not too sure. I know it goes down or something.
Absolutely, yeah.
Yeah.
The more spine deformity you have,
Yeah.
the more traction it puts in the spinal cord. And the brain is stationed inside your skull, right?
Yeah.
But it tractions, it pulls it.
Yeah, okay.
Yeah,
Okay.
so actually the lower part of the brain can actually deform based on how much tension is put on the spinal cord.
And the vagus nerve goes all sort of...
Well, it can affect all the cranial nerves, the lower ones anyway, for sure.
Okay.
Yeah, cranial nerves 5 through 12. Below the halfway point, the tentorium in the brain can all be affected by really bad posture and traction on the spinal cord pulling down.
Helps it to... The traction and pulling down helps it to...
It doesn't help it, it impedes it.
Oh.
Your hunch posture is tractioning your whole brain, the lower part of your brain.
I mean, it helps it recover, get better.
The function of...
Yeah. Oh, I see what you're saying. The bad posture.
So you fix your posture, you take that tension off.
Yeah,
right?
got it. Okay. Okay.
That's what we're doing with you.
Yeah, kind of like opening up the nerve compression, whatever. In my sort of very simple terms.
Taking the tension off.
Yes.
The spine is not going to be bent forward more.
Yeah, yeah.
You correct the spine, and the tension is taken off because whenever your spine bends forward, the actual length of the spinal canal that houses the spinal cord is longer. Therefore, it's stretching the spinal cord more.
Okay, got it.
You know, and of course, the spinal cord is meant to stretch, but there's limits to it, right?
Yeah.
Walking around and you dynamically bend forward and you're really hunched in the first place, you know, then it's easy to pass that critical threshold and do damage to the spinal cord itself and the nerves. And this dynamic, repetitive strain to the spinal cord and nerves creates this chronic neurological problems in a lot of people. It's always overlooked by neurosurgeons.
Yeah, they've been watching our stuff. Any question I get, and I don't know, I'm going to ask you.
That's right. Bottom line answer is that you need to correct your posture.
Yes.
But it takes a while to do that. We can't just do that overnight or in a week or two. It takes usually many months or even a year.
Basically, to be clear, you're saying with incorrect posture, like slouched forward or whatever, it elongates the spinal canal, putting stress on the spinal cord, which then can pull on the brain, deforming the lower part of the brain. Putting pressure on those
downwards on the brain stem and lower part of the brain.
Deforming the shape of it, I guess. Is that right?
Yeah, exactly, yeah.
Okay.
That was proven in the 60s with Alf Bragg's work. He published 3 books and a bunch of papers, and he did full spine cadavers, dead people, and he would position them in different ways, and he would measure and visually and see, and just hold a ruler up to the spinal cord and put little flags in and move the neck around, the legs around, hunch the whole body, and he really demonstrated biomechanically that the nervous system, your brain, spinal cord, and all the nerves through your body are all connected, and so they all get affected from distant areas. Yeah.
So basically by doing that, manipulating the body that way, he would the spinal cord would elongate. And
he visually demonstrated that
with cadavers.
With cadavers, yeah.
Amazing.
Yeah. It'd be interesting for people in that group to take a friend of theirs, a family member, to take a picture, just them standing in their neutral standing position. Take a side picture of their profile to see if they have the same thing, and I'm sure it's pretty common. Just get them to stand
like straight
with their feet hip widths apart in a relaxed position, you know. A picture straight on that has the whole body, and then from the side view as well.
So like a profile. So they
and then you can assess
full body profile shot.
Exactly, just how they stand.
Natural position.
They likely have bad postures just like you do.
Yeah.
Forward head, hunched, all these things. Yeah.
Which all can contribute, obviously, to this particular condition as well.
Yeah.
Okay. Yep. That's wonderful. That's good to know. Thank you.
You're welcome.
Oh, it's so amazing.